Today I am going to discuss about the anatomy and physiology for the GNM first year. So unit 6 and respiratory system. So in last class we have seen about the inspiratory muscles. So the muscles which are involved in the respiratory system, there is a inspiratory muscles and the expiratory muscles. So last class we have seen about the inspiratory muscles. So today we are going to discuss about the expiratory muscles. So it is a part of the part 2 about the muscles which are involved in the respiratory system. So last class we have seen about the inspiratory muscles which include the diaphragmatic muscles and the internal intercostal muscles. So now today we are going to discuss about the expiratory muscles. So in this expiratory muscles there are the two types, the muscles of anterior abdominal wall and the internal intercostal muscle. So the expiratory muscles can be, there is a two types included in the expiratory muscles. There is a muscles of anterior abdominal wall and the internal intercostal muscle. So there is a three types of muscles can be involved in the respiratory system, that is inspiratory muscles and the expiratory muscles and the accessory muscles for the respiration. So last class we have seen about the inspiratory muscles, in that included there is a diaphragmatic muscles and the external intercostal muscles. So today we are going to discuss about the expiratory muscles. So in this expiratory muscles there is a muscles of the anterior abdominal wall. So there is a muscles can be involved in the anterior abdominal wall for the expiration. So there is a some of the muscles can be involved in the anterior abdominal wall. In that first one is Rectus Abdominis and Pyramidalis and the internal oblique muscles and the external oblique muscles and the transverse abdominis. So these are the muscles can be involved in the anterior abdominal wall. So first one is Rectus Abdominis, and this is Rectus Abdominis. There is a abdominal muscle and is paired muscle running vertically on each side of anterior wall of the abdomen. So the Rectus Abdominis, it is one of the abdominal muscle and it can be running vertically on each side of the anterior wall of the abdomen. So Rectus Abdominis is, there is a one of the abdominal muscle, it can be running anteriorly, it can be running vertically and each side of the anterior abdominal wall. So it can be running vertically anterior wall of the abdomen. So Rectus Abdominalis is a passing, running through the anterior wall of the abdomen. So the Rectus Abdominis is the one of the anterior abdominal muscle. So next one is Pyramidalis. So Pyramidalis means it is a paired muscle running abdominal wall and found on each side of the linea alba. So there is a Pyramidalis means it is also one of the abdominal wall, abdominal muscle, and it is become paired muscle. So paired muscle and it can be running abdominal wall through the abdominal wall. So this Pyramidalis can also be running through the anterior wall of the abdomen and it can be found on the each side of the linea alba. So the Pyramidalis can be situated and found on each side of the linea alba. So linea alba means there is a, it can be start from the tip of the xiphoid process of the sternum. So xiphoid process means there is a tip of the end of the sternum. So end part of the sternum called as xiphoid process. So the linea alba can be originated from the tip of the xiphoid process of the sternum. So xiphoid process means there is a end of the sternum. So there is a Pyramidalis means it is become paired muscle and running anteriorly through the abdominal wall, and there is a found on each side of the linea alba. So it can be found on each side of the linea alba. So linea alba, it can be originates on the xiphoid tip of the xiphoid process of the sternum. So xiphoid process means there is a end part of the sternum. So it is called as linea alba. And next muscle is internal oblique muscle. So internal oblique muscle, it is also one of the abdominal muscle, and it is an abdomen muscle in the abdominal wall. So interior oblique muscle can be situated inside of the abdominal wall. So there is in this name also there is a internal means inside of the abdominal wall the muscle can be situated. So it is called as internal oblique muscle. And there is a next one is external oblique muscle. External oblique muscle, the muscles are located on the outer surface of the sides of the abdomen. So the external oblique muscles can be situated, and the external muscles are located on the outer surface of the sides of the abdomen. So the external name itself, the outer surface of the abdomen, the external oblique muscles can be situated, and each side of the rectus abdominis, and there is a muscles extends from the lower ribs to pelvis. So the external oblique muscles can be extends from the lower ribs to the pelvis. So from the lower ribs to the pelvis, the external oblique muscles can be extended, and the external oblique muscles can be situated the each side of the rectus abdominis. And each side of the rectus abdominis, the external oblique muscles can be situated. So it is about the external oblique. So the muscles can be located on surface of the outer surface of the sides of the abdomen. So outer surface of the sides of the abdomen and each side of the rectus abdominis, and muscles extend from the lower ribs to the pelvis. So the muscles can be extended from the lower ribs to the pelvis. So next one is transverse abdominis, and transverse abdominis means there is a broad paired muscle sheet and found on the lateral side of the abdominal wall. So transverse abdominis, it is also one of the abdominal muscle. It can be found on broad and paired muscle sheet, and found it can be situated at the lateral side of the abdominal wall and along with the external and the internal oblique muscles. So along with the external and the internal oblique muscles, the transverse abdominis can be situated in the lateral side of the abdominal muscle. So this is about the transverse abdominis. So the muscles can be involved in the expiration. There is a rectus abdominis and pyramidalis and internal oblique muscles and the external oblique muscles and the transverse abdominis muscles. So then we are going to discuss about the internal intercostal muscles. So it is about the expiratory muscles. In this first one, muscles of anterior abdominal wall. So in this muscles of anterior abdominal wall, there is some types, includes the rectus abdominis and the pyramidalis and the internal oblique and the external oblique and the transverse abdominis. And in the second type is internal intercostal muscles. So internal intercostal muscles, the muscles occupy the intermediate layer of the intercostal space. So the muscles can be occupy the intermediate layer of the intercostal space. So intercostal space means the space can be between the ribs. So the space between the ribs, it is called as intercostal space. So the internal intercostal muscles can be occupy the intermediate layer of the intercostal space. So there is an intermediate layer can be situated in the intercostal space, and from this intermediate layer the internal intercostal muscles can be occupied, and this extends downward and the backward from the lower border of the rib. So the intercostal muscles can be extends from the downward and the backward from the lower border of the rib to the upper border of the rib. So the intercostal muscles can be extend from the downward and the backward and from the lower part of the rib to the upper part of the rib. So the internal intercostal muscles can be passed through the lower border of the ribs to the upper border of the ribs, and crossing the external intercostal muscles at the right angle. So internal intercostal muscles can be across the external intercostal muscles at the right angle. So it is about the internal intercostal muscles. So internal intercostal muscles can be occupy the intermediate layer of the intercostal space. Intercostal space nothing but there is a space between the ribs. So it is called as intercostal space. So there is a middle layer of the intercostal space, and the internal muscles can be occupied from the lower border of the downward and the backward and from the lower border of the rib to the upper border of the rib. So the internal muscles can be extend from the lower border of the rib to the outer border of the rib, and there is a crossing the external intercostal muscles at the right angle. So right side, and there is a internal intercostal muscles can be across the external intercostal muscles. So it is about the internal intercostal muscles. Next one, accessory muscles of respiration. So accessory muscles also can be help for the respiration. In this first one is scalenate. So there is a scalenate, it is a muscle name, and it can be helps for the elevation of the thoracic cage. So while the expiration and the inspiration, the elevation of the thoracic cage can be occurred by the scalenate muscles. So the scalenate muscles can be help for the elevation of the thoracic cage during the expiration and the inspiration. And there is a next one, sternocleidomastoid muscles. Sternocleidomastoid muscles and the cause elevation of thoracic cage. So there is a cause elevation of the thoracic cage. So sternocleidomastoid also, there is a sternocleidomastoid muscles also can be help for the elevation of the thoracic cage during the inspiration and the expiration. So the scalenate and the sternocleidomastoid muscles can be help for the elevation of the thoracic cage during the inspiration and the expiration. So next one is serratus anterior muscle. So it can be help in the fixing the thoracic cage so that the ribs can move efficiently. So it can be help for the fixing the thoracic cage. So because of this fixing of the thoracic cage, so the ribs can be moved efficiently. So if the thoracic cage if not become fixed, and thoracic cage also moves. So because of this the serratus anterior muscles can be help for the fixing the thoracic cage. So because of this fixing of the thoracic cage, there is a movement can be occur in the ribs. So it is about the serratus anterior muscles. So it can be help for the fixing of the thoracic cage, and there is a so that the ribs can be moved efficiently. So next one is during inhalation and sternocleidomastoid and scaleno and pectoralis muscles can be used. So during the inhalation of the air, the muscles can be sternocleidomastoid and scalenate, and the pectoralis muscles can be used during the inhalation of the air. And next one is during exhalation there is a external internal oblique muscles and the transverse muscle and the rectus abdominis and the internal intercostal muscles can be held for the there is a during the exhalation. So exhalation of the airing to expel the air from the body, the muscles can be held, the external and the internal oblique muscles and the transverse and the rectus abdominis and the internal intercostal muscles can be held for the expel the air. So exhalation of the air, the muscles can be held for the exhalation of the air. So it is about the accessory muscles of respiration, the scalene and the sternocleidomastoid muscles. It can be held for the elevation of the thoracic cage during the inspiration and the expiration. And there is a serratus anterior muscles can be held for the fixing the thoracic cage so that the ribs cannot move efficiently. And during the inhalation, sternocleidomastoid and scalene pectoralis muscles can be used. And during the exhalation, there is the external and the internal oblique and the transverse and internal intercostal muscles can be used. So it's complete about the muscles can be involved in the respiratory system. So it is complete the muscles can be involved in the respiratory system.